The doctors, it's very difficult for them to calculate the overhead of the hospitals or the clinics, and we know all the doctors, they are not that much in the math. But time also, we use it as assessment tools, right? So in the assessment tools, we have tissue debridement. All of us, we know that, and we study that, and every year, most of the companies, they stress on the time as a wound assessment. But also we use this time in the wound. We put the 5 point technique, photoablation, it's by laser. We remove the biofilm, and this is the first step to remove any biofilm, planktonic bacteria, or eschar from the tissue. Whatever the type of eschar or the hardness of the tissue, you can remove it by laser just by change and adjust the parameters. And photomodulation, we believe if you put radio frequency, ultrasound, electric, any electromagnetic field inside the wound, you will change some signals. Like if we have in this room a lot of cells, and each cells communicate in different way. If you put coherent light, and this coherent light with the same wavelength, it will give the cells the same signals. So it will make all the cells move. So it will be very difficult, and the curve of the number of wounds in the worldwide increasing year after year. So when we talk about laser or the normal healing, I think all of you, they know the stages of wound healing, from hemostasis, inflammation, proliferative, and remodeling, which take sometimes from 1 year or 2 years for the collagen remodeling. And if we look here to the inflammatory stages, okay, it's not separated from each other, it's overlapped. From the first stage, second stage, or the third stage, it's overlapped over each other. If we have actually the wound in the chronicity stage gets stuck in the second stage, and it takes sometimes 1 year or 2 years. And this is the problem we have in all our cases. So if we look to the factors that make stalled wound or chronicity, maybe the major factor is the biofilm, right? And the bacteria, normal what we have, right? Before we have like traditional medicine, basic wound dressing, like gauze, cotton, all these things. And now we have a smart dressing. And some doctors, they started with regenerative medicine, structural scaffolding cells, or stem cells, or SPF derived from adipose tissue, or growth factors, BRB, or different types or sources of growth factors. But now we are using also the technology parallel to all these things, with the basic dressing, smart dressing, or the technology. Whatever you want to do, and how you want to do or change the morphology of the wound and changing the environment. I'm talking about the microenvironment inside the wound. You can do this with high selectivity. So to diagnose a chronic wound is easy, whereas treating the wound is a challenge, involving high cost. Wound healing is a complex and dynamic process of replacing devitalized and missing cellular structure and tissue layer. The doctors, it's very difficult for them to calculate the overhead of the hospitals or the clinics, and we know all the doctors, they are not that much in the math. But time also, we use it as assessment tools, right? So in the assessment tools, we have tissue debridement. All of us, we know that, and we study that, and every year, most of the companies, they stress on the time as a wound assessment. But also we use this time in the wound. We put the 5 point technique, photoablation, it's by laser. We remove the biofilm, and this is the first step to remove any biofilm, planktonic bacteria, or eschar from the tissue. Whatever the type of eschar or the hardness of the tissue, you can remove it by laser just by change and adjust the parameters. And photomodulation, we believe if you put radio frequency, ultrasound, electric, any electromagnetic field inside the wound, you will change some signals. Like if we have in this room a lot of cells, and each cells communicate in different way. If you put coherent light, and this coherent light with the same wavelength, it will give the cells the same signals. So it will make all the cells move and happen. So it's like you change the signals, or you change something, or retrafficking of the neutrophils, or the inflammation, or like you do photomodulation for this wound by changing the environment and changing the signals between the cells and the communication. In this point, you're helping this horse to go to the other side and leave. It will continue. So this means the communication disconnected in the second stage, which is the inflammatory stage. And we will have a prolonged inflammatory process, like abnormal inflammatory reaction and sometimes infection. So if we think again about the 4 stages, this is the normal what we have, right? Before we have like traditional medicine, basic wound dressing, like gauze, cotton, all these things. And now we have smart dressing. And some doctors, they started with regenerative medicine, structural scaffolding cells, or stem cells, or SPF derived from adipose tissue, or growth factors, PRP, or different types or sources of growth factors. But now we are using also the technology parallel to all these things, with the basic dressing, smart dressing, or the technology.
The floor is for donations.
If we come to the margin 4 centimeters around the wound, the peri-wound area, and do like acupuncture, just like 2 millimeters around the wound, like you burn the wound, but really you just do stimulation, like excitation for the tissue. It will help normal inflammatory response. Photocutting for the edge. We know that if you have edge, it's very important, the shape of the edge, very important for epithelialization or cell migration, not granulation tissue. Granulation tissue, mainly it comes from down to up. But cell migration, there is a movement, like an epic movement, right? Between actin and myosin. And this cell movement, actually, from side to side, it will be perfect if you have like sloping edge, not epipoly, everted or inverted, right? This is why we refresh by blade, we refresh the edge. So here by laser, by 90 degrees, we can hit under the tissue, under the edge of the wound, to make the wound sloping. So it will help in the cell migration by changing the morphology of the collagen there. And photovaporization, if we have a wound, and inside this tissue, we can evaporate in special temperature more than protein denaturation here. And after the treatment, it becomes smaller, okay? And see the time of granulation tissue, it's ready for graft. We use this machine also, post-graft. Imagine you have the grafted area and you have this skin graft. It's a protein. If you put heat, you will do like welding, like a glue, okay? So we'll integrate with the tissue. At the same time, we remove the water and all the plastic surgery, they know that if there is exudate, maybe it will take the skin graft away. This also, case of burn, we use it for acute cases as well. You can see this is skin type 3, and you see the hyperpigmentation around, but here it helps also in the hyperpigmentation around the wound. This is case with wound exposed. This is very important. And the orthopedic doctors, sometimes if there is wound exposed, they do fenestration, drilling, right? They take the patient to the OT and do like small opening to allow the undifferentiated stem cells to come from inside and cover the periosteum and save the bone. This is what they are doing, or decortication. We can do this in a clean room without any anesthesia in 4 minutes. you can open like 20 small openings and you can see the blood come out from these openings. This is a case I do for skin graft, and you can see using CO2 laser. And the mission from this is to deliver superior quality treatment and services for our patients and communities through latest guidelines and innovative protocols. So we have 5 points technique, and we treated around 1,600 patients with this technique. While wound is a major healthcare concern, it can affect different ages. It can affect a lot of patients. It's not one disease, it's different type of disease and with different stages. So it will be very difficult, and the curve of the number of wounds in the worldwide increasing year after year. So when we talk about laser or the normal healing, I think all of you, they know the stages of wound healing, from hemostasis, inflammation, proliferative, and remodeling, which take sometimes from 1 year or 2 years for the collagen remodeling. And if we look here to the inflammatory stages, okay, it's not separated from each other, it's overlapped. From the first stage, second stage, or the third stage, it's overlapped over each other. So what is the problem actually? When we think about chronicity or the chronic wound, we have two modes of action. We stimulate the fibroblast by oxygen and the light, and this is the interaction between the collagen and our body. And at the same time, I can increase the temperature. Okay, if I increase the temperature, I can play with this collagen and change the morphology, especially in the foods. So how is that? Sorry. Our collagen, actually, if you think about jello, it's the jello and our cells like the fruit inside this jello. Okay? And we have 33% of our body protein is collagen, especially collagen type 1. And think about this table. My temperature now in front of you is 37, 36.7. If I increase the temperature to 45, what will happen in my protein? To 60, we have a protein denaturation, which is coagulation. And if you increase it to 100, you have evaporation. So this is in the last step. We do like zigzag in the wound, especially in the abdomen, to decrease the size. And this is your target as a wound specialist, to decrease the size of the wound. It's like egg. If your egg is a protein and my collagen